and pandemics. Welcome back to the show, Kenneth.
Thank you, Priscilla.
And I know that you've just been here recently, but the reality is what brings you back here so fast. First, the pandemic, COVID-19. Now we do have Ebola that has caused government to make tough decisions. Most toughest decision that has happened the last 48 hours is having to cut the third term school by 2 weeks, have the children go back home by the 25th of November, directive from the government, all in the name of controlling the pandemic. Right there is a paper in front of you. Ebola kills 8 children in the span of the fight, and it's a terrible virus that we are faced with amidst the COVID-19 that we cannot say has gone. Maybe we may not be talking about it as much, but I believe that it's still within our society. Are we forgetting the dangers of COVID-19?
Absolutely, and good morning, our viewers. So first, we draw examples from the HIV now epidemic, that viruses do not easily get eliminated. And this is because of what we call mutation. The viruses change or modify the materials that help them to genetically replicate. It changes, so there are errors as it changes. A virus can only survive by replicating. And we've seen that with HIV. That's why we've taken long without eliminating it, because it keeps changing. You find a medicine for it today, tomorrow it changes something else. And same as COVID-19. And that's the very reason we should not forget about COVID. It's still with us. Just even last month, we had over 77 cases, and those are the ones that are testing, and our testing is very, very low. So that's the concern that we have, that we seem to be relaxing and getting back to our comfort zones, but viruses don't easily go. And one of the key strategies, as you've highlighted, is testing and treating them. Testing is prevention. Testing is the baseline for any intervention, and that's why we are focused on more promoting testing within our communities.
Okay, so how is the situation like right now? Because you're dealing with 2 different viruses, but they're both dangerous, and they're causing health crisis to the sector, but also to the population in Uganda.
So first is testing. In the beginning, it was not easily accessible. But over the 2 years, we've had new testing kits, in particular rapid diagnostic test kits, which help with surveillance. So if you have any suspected or symptoms of COVID, it's recommended that you do an RDT test. And that helps us in profiling the epidemic, knowing where it is, where we have many cases, and that helps us with isolation, it helps us with management, it helps us also with treatment, but it has to be done early enough. And as you'll hear, we now have new drugs for treating COVID. I don't know if you've heard of a drug called Paxlovid. It's a new drug that's used for treating COVID, produced by Pfizer. And what's even more exciting is that Pfizer signed an agreement with a global fund, and the 132 countries that benefit from global fund will access the 6 million doses that will be procured. So I think we're moving towards eliminating COVID. I believe we now have all the tools that we need, and key of those is testing, but also treating. And that drug can only work if those symptoms or if COVID is detected within the first 5 days. And then that reduces hospitalization rates by 80%. Okay. So it's a key step in eliminating COVID. But we must know who has it and who doesn't.
Okay, key step, but seemingly the reality is different. There seems to be laid backness on testing, especially for COVID-19. So how is Uganda faring on keeping up the pace that it started with on the testing element of ensuring that COVID-19 comes to an end?
As a country, and a month ago we did a nationwide survey on assessing availability and access to testing. It's very interesting that we have actual availability of the tests, especially the RDTs, is up over 86%. But utilization, on the other hand, is very, very low, at least from about 500 people we interviewed at health facilities who have had signs of COVID. Only 41% reported to have tested. And that also, if you look at our national statistics and the global metrics that was given for testing for COVID, testing 100 per 100,000 per population, we are way below that as a country. And that shows that we've not utilized these services as much as we should. And the other interesting thing is that the perceptions people have had about COVID, you've mentioned it, I think we are now relaxed thinking it's gone. There is a very low risk perception that we saw in this survey. Even we saw health workers themselves, about 56% also thinking that testing should only be for people that have been in contact with someone who is already positive. However, it should be that if you're from a high-risk area, you should test. But we also saw less than 30% thinking that if I'm from a high-risk area, for example, let's use Ebola now. If I went to Mubende or Mitiana, people believe only less than 30% I should be tested. That's for COVID. However, in practice, in public health, if you've been to such an area, the standard practice should be you should get tested or screened at least at their minimum for that infection.
Okay, all right. So how do we then go back to that place where testing is very vigilant in communities, both from the side of the facilities, but also in response from the population?
So I think with the exciting news of treatment options for COVID, I think we should be inspired to test because we know now that there is treatment for COVID. Before you would test, and also in the survey we saw fear of people being found positive was one of the reasons they were not testing. And by then we were only treating symptoms. We did not have any treatment options other than treating the symptoms you had, the high temperature, managing pain, managing the fevers. That's all we would treat. But now we know we have an antivirus or antiretroviral medication. So that should inspire us to test more. And a virus can only be eliminated by starving it, not allowing it to replicate. And now we have at least medication to stop that. And I think for the first time now, I think there is hope on the horizon that we can eliminate COVID with the tools now that we have. I think this is the fastest innovations we've seen, be it for vaccines, be it for treatment, and the testing platforms. Since the onset of COVID, I remember back in in March 2020, when COVID was declared a public health a pandemic, we've seen innovations at a very, very fast speed. And though that's not matched with the uptake and utilization of these technologies, and that's where now we need to have strengthened interventions on utilization.
Okay, all right. Thank you so much, Kenneth Mwehonge, who's the Executive Director for Health Promotion